In this video, I'm going to be specifically focusing on this concept of anhedonia. And one of my viewers has asked me about the link with anhedonia and long COVID. Well, first of all, what is anhedonia? Anhedonia is any kind of inability to feel any sort of pleasure from previous experiences that have actually given you pleasure. So it's a very much a psychological term, and I am no psychologist, but this is effectively our inability to experience any pleasure, and these were previously activities that we would have enjoyed. So it is just that state of not experiencing anything useful. There are two types of anhedonia that has been documented. One is, of course, the physical anhedonia, so where you don't experience any pleasure from physical activities. And the more commonly seen, the social anhedonia, where you stop experiencing pleasure from interactions with your near and dear ones or experiences with your friends, where previously you would have really enjoyed that. Now, these are things that are often seen in the context of mental health disorders. Indeed, anhedonia has been reported predominantly in sort of depressive disorders, in anxiety disorders, and even in some patients with schizophrenia. Clearly, these kind of disorders can also be happening with certain physical health conditions as well. Major surgery, major cancer or life-changing diagnosis or treatment can also give rise to a certain degree of anhedonia, but these might be quite temporary. So providing the support is quite important for those medical conditions, and that often can help in resolution of anhedonia. But if it persists, then the way anhedonia is generally managed is usually by looking at psychological techniques. So psychotherapy of a variety of kinds can be tried, and if that isn't helpful or not completely helpful, we could consider adding in some drug-based treatments. Usually it is a combination of either antidepressant drugs or nerve medication that are used. So that's usually the overall management of anhedonia. Often, if this is related to anxiety or a particular medical condition, anhedonia is short-lived, but in the context of major depressive disorders or schizophrenia, it might be a more long-term persistent issue that doesn't respond well to treatment. Now, what about anhedonia in the context of long COVID? Now, we understand, and certainly in my experience from the long COVID clinics that I have done, we see a lot of patients who have experienced significant fatigue because of the way the virus affects. And that virus impact on the nervous and immune system can cause an impact on the physical and mental health, and that can result in anhedonia. So we do know that at a brain level, there is some understanding that changes in the brain circuitry where the reward circuits lie and the change in the dopamine chemical being released can contribute to anhedonia. So we are certainly looking at some chemical imbalance as well, which might be contributing to certain cases of anhedonia in the context of long COVID. But broadly, in my view, anhedonia is not seen in every person with long COVID, but it is a common association because of all the other changes I mentioned to your physical and mental health. I hope this video is helpful, and thank you for watching it, and I shall see you in the next video. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.